And the hospital won't have usually just one kind, there'll be however many, they replace them as they need, and so.
Actually, you guys are pretty lucky because this bed was donated to us and it's new. Before, we used to have a bed that has like a crank, so we were like, oh my God. So when they called us and said, hey, you guys need a bed, we're like, yes. So this is actually newer.
They'll have brakes on them, of course,
Always.
okay? You'll be able to brake it and not be able to move it, and then there's a steer position. Like, well, what's steer for? Okay, what steer does is that locks the alignment of one side of the wheels. Think about how a grocery cart works. You know, one side of the wheels turns, it just swivels, and the other one's set. And so that actually helps you to steer these things sometimes. Keeps one end from drifting. That end is the steer end, and they're set straight, and I can manipulate the direction by this end once I get close to a doorway or something. If I don't have it to steer, sometimes the whole thing will want to drift into the wall. So by having it set to steer rather than freewheel, if you will, then sometimes that gives us a little more control, a little better control. All right, handrails. We'll have some sort of handrail mechanism. Find the release mechanism, figure out how that works. In this case, you've got a deal there, but again, they're different. So you have to figure out on your particular gurney how it works. Sometimes you'll need to lift the patient up. Some of your patients don't breathe well, whatever. So that is a comfort option for our patients. We'll put a pillow on here. We're going to have to use those for something else in a minute. Let's think about directionality. Okay, we discussed this, see if you remember. How do we move a patient? What direction do we push them?
Feet first.
Except for the elevator. The elevator, you go in there head first. Our elevator is large enough to accommodate one of these. So what we're going to do as we break up into teams is we're going to transport a patient all the way downstairs, in and out of the elevator. Yeah, one's going to go, and then after we've had a little bit of time, I'm going to send another team, and they're going to go. Once we've done that a few times, it's probably enough. Then we'll come over here. As one comes back, we'll move on to the bed and back. That's how we're going to do this. Okay, who's our first team? Not doing it, Look at they're all scared. Oh, no.
If no one volunteers, I'll start pointing. There you go.
One. So, we need circulator, anesthesia, 4 people to go along with this guy.
We're in a
He's going to be part of the team. Moving down the hallway, we don't have to have that many, but we're going to have that many when we come back in here and
So Phil,
transport. Tell you what else we want to do.
please send it to Christina.
I am.
Let me see how fast you can. Pretend this guy's got an IV.
We will, why does he have to have glasses on?
Mr. Cool.
having eye surgery? Eye surgery. So usually if they have those, right, the glasses, right, you have to make sure if they have dentures, those are the things that we want to make sure that the patient gives to us, because if we lose it in the OR, then that's an issue. The patient wakes up and says, oh, where are my glasses? Or where are my dentures? And if you did not, so usually the circulator, when they are in holding area, that is the time where they say, hey, do you have dentures or whatever? So they usually give them like these denture
They'll start a line.
or storage. And then if they have a pair of glasses, so usually they give them to either their family member if they have them there, or they'll keep them with their things and they have the locker room.
It's usually the free of the deposit already in the free of before transporting the free.
Right, that's exactly right. So before,
This patient's got to fall off the bed.
Y'all gotta put the rails up.
Yeah.
who's the circulator in here?
Okay. Just kind of wrap this around your arm a little bit. Okay, so, a lot of times your patient's gonna have IVs, gonna have maybe a lot of them, maybe infusion pumps, maybe complicated things. So, often you need somebody to push pull.
What's
Okay?
my oxygen?
It's all right.
Right, push the pull.
It's
But
good.
sometimes-
It's an interesting point you mentioned though. Where would you put oxygen? If you had oxygen.
You'd have to lay it on the bed because there's no rack.
Yeah, this one doesn't. Some of them will have a little space down here for
Right,
it.
Yep.
This
that's
one
true.
doesn't.
So it's most of the time, then you would have to put them somewhere.
Yeah, it's really not supposed to do
You're
that.
not supposed to do that, but,
Right there.
Yeah, there's a hole at the bottom.
or sometimes,
This one?
oh, maybe they probably, no, that's for the,
Somebody control.
It says O2 storage, right there.
yeah,
That
yeah,
rack right
exactly.
there.
Maybe that's where
It
they
is what it
put
is.
them.
Yeah,
But that's
right
kind
there's
of
where your
like a
tank goes.
But anyway.
Okay, so, I want this group to take, well, he's covered. We privacy, right? We gotta be mindful, so grab a blanket. Well, modesty, if you will. You know, people are stripped down
I
to
gotta
a,
do this too?
stripped down to a hospital gown at this point.
What? I gotta bring this in.
This
Or
is like,
somebody, you can employ somebody, or you can,
Remember,
sometimes you, a person in
what
charge
he
of it by
said,
themselves.
they usually give the patient a warm blanket, right?
Yeah.
Wherever they go, there's always a warmer, and the patient needs to be
I
covered,
love this
Yeah.
blanket.
right? The
If you
I want
feel-
one in my house.
If you feel this thing pulling on you, you should like scream at it, okay? Alright, so, head out the doors, and,
Somebody,
yeah.
Ozzy, you can
Now,
help.
probably we're gonna have to make this thing easier, we're probably gonna have to clear some space, because we really need to go out this door over here.
Huh? Oh.
Yeah, we're going down.
I thought he meant there.
No, that way.
Get closer.
Alright, so, if you're not involved in this, come over here and help me move some stuff.
You're about to lose his eye.
What kind of procedure would you like today, sir?
Alright, so grab a stand too, we're gonna take it right down the floor with it.
Remove your testicle. You can take care of that right here. Save you.
all right, just hold up, guys.
Hold on, it's moving some stuff out y'all's way. Hold on. Yeah, but we're having to hit the cabinet. Wait.
Good.
Oh, it's in the stairs. Oh, sorry.
I don't think you're gonna make it, need more stuff, come on, people, I'm gonna wait on.
Go, Hannah,
Let's
go.
get out of here.
Sorry, sir. I didn't come my hallway. Whoa, Greg. Get on the end.
Do the microscope, and it will roll, let's do this too. All those janky mayo stands, let's get those out of here.
These are janky. Raggedy is the word.
We're gonna not move in the hallway, there's actually a place we're gonna do. We'll let them get out.
Come on, girl.
Yeah, I'm coming, I'm coming.
Hold on, wait, Greg.
You got it steer, so you're controlling it.
I know, but he's pulling it.
Alright, all this stuff is our
IVs are
closet.
coming out. Alright. Are we all going somewhere?
No, not everybody.
You gotta go that way. You're about to make that. You gotta go head first.
You know,
Automatic.
I think we should probably wait for him before we proceed any further, so that we know exactly what we're doing and where we're going.
Head in the elevator, right?
Yeah.
He told you guys that?
It's on my lecture.
We turn them around.
Turn around first.
Remember, it goes feet first everywhere, but in the elevator, unless the OR room is small.
I'm pretty sure you're not supposed to prop your foot up like Captain Morgan on a bed.
Can you lift my head a little bit? Up?
Okay.
Thank you.
Is that good? No, we thought we were supposed to wait. But you could be our door holder. Our doors aren't automatic.
It's not automatic, yeah, you gotta have people for that. Somebody's gonna hold them, right?
Yes, we need your assistance.
Yeah, come up, you can follow me.
Alright. Turn around. Turn around.
No, no singing.
Probably want to take it out of steer if you're going on the elevator.
What?
It's a lot easier to get on the elevator out of steer.
Yeah, that way he can swing the rear end around. He said it would.
Yeah. I hope so. I'm scared of elevators.
Don't be alright. Be asleep right now.
Just say, good thing I'm not on the gurney. I'd be asleep already.
I like to volunteer like this.
No, you gotta relax.
Make sure the elevator's clear. You're gonna feel a little bump.
Couple bumps.
Yeah, but what about mine?
Come on, you got it, you got it, you got it.
Alright.
See you later.
Did you push the button?
I did.
What floor are we going to?
Second floor.
We're gonna leave in the basement.
So do I
Exactly.
need to put it in steer to get out?
This one didn't take. No, if I were you, I just wait till you get out and then put it. Then worry about steer.
Alright.
That's first floor.
Going out. Come on, girl.
Say, Ozzy, wait. Make sure you don't. You know, he doesn't scream because you.
Alright, let's turn around. Alright.
So, just on the steer thing, who steers? The front person, right?
You.
These would be,
No, they automatically both move.
Yeah, they both automatically move.
so which one freezes?
But I'm
Yours
I'm
will.
in charge.
The red or the orange?
Whenever I
The
call
red or
the
the orange, the freeze is
I call the
That's lock. Well, it says brake.
going up, going up.
No, that's great. The red one.
No, it's just when you're like the elevator. He
screwed.
said it's easier to get in without steer. But like when we were going down the hallway, I had it
You
in
had it.
steer. All right.
All right, so we'll go back.
That's what we need right now. All right.
It looks like usually if you go in first, you have room.
No, it's okay. I'll sit. Just don't go too.
I don't know, you came out last, so.
Oh God. Ozzy. Normally they have it on the bed anyway.
Yeah, normally there's a
Thank
pole.
God.
You okay? Sir?
Yes, ma'am. People are probably looking at us.
What are you doing?
Alright, going out.
Going out.
Ozzy does the hard part. Alright, I'm gonna switch it to steer.
Okay.
Okay, you gotta go feet first now.
So we'll go.
Go feet first.
All right.
Oh God, what was that?
The wheel's locked.
Huh?
The wheel's locked
Why?
because it's supposed to. He took it out of steer.
You're supposed to lock?
No, it's not supposed to be out. Oh, excuse me.
Oh, it's all taken off.
Good. You don't have to be buckled, you can stay, facing your line, just get that, yeah, right. Just do it. Just get the, when the people get in the,
Alright. We're about to hit the wall. I can't. Pull your side.
Oh my God!
There we
What the
go.
hell did I sign up for?
Door. Door,
This way, talk to Jack.
Are you like?
There you go.
They're coming out.
Yeah, that way or this way?
Alright, we'll put him by the wall.
You gotta take it out of steer.
He's
Take it out.
holding. Sir. Alright, sir. Get up. Put him in the screen and lock it.
Rip the IV out before it goes on.
Girl, you gotta get it under the bed. Like, put a lot of it under the bed.
Thank God we're not transporters.
Well, they're going. I don't know what you guys are waiting on.
Huh?
I don't know what you're waiting on.
What are you waiting on? Take it out of lock. Bring it on back
Because we
in.
couldn't get in there with them.
They've been going for a while.
We're gonna turn around.
That's right. So usually you don't have room to turn around inside your OR. So you're thinking to line this up with the bed, you turn around out here. All right, so we're gonna put them on the table, right? The table locked? You know if the table's locked?
Yes, it's locked.
Always want to check that the table is locked.
Ozzy, what are you doing?
Doing what?
You've broken it.
How to put it down? How to put it
Look,
down?
you broke it. Just step away. I'll fix it.
Okay.
Probably a handle in there you squeeze.
Yeah.
Oh, okay.
Squeeze, and then you can adjust it to
Well,
whatever.
you can get your.
Wait, I
Leave it
just
alone.
wanna-
Leave it alone. Leave it alone. Leave it
I
alone.
just wanna.
Just leave it alone.
on this.
Okay, when you
Release
get close
mine.
enough, you get pretty close, you can drop that.
Drop.
Drop it. Drop it like it's hot.
There you go.
Please don't talk.
Okay, so you have to compare the heights of this and this.
Going up.
You're
Yeah, you got
doing
stuff in the way there, don't you? Bummer, huh?
I'm burning up. This is a good workout.
There you go.
It's a little low.
One thing you gotta be a little bit careful of is
That's enough.
sometimes you'll be so close to the bed that there'll be something hanging off of the bed that catches on the edge of this gurney. You're trying to raise it. And it's not working, and you're trying to lift the whole OR table, and that's not gonna work very good. So be mindful of that. Okay? Okay, we're gonna use, we're gonna let the patient move themselves, because that's typically how, when they come in, they're usually ambulatory. We're gonna communicate with our patient. Okay? We got a hospital again. You can leave the blanket on them, actually. Okay? Usually they'll move with their blanket. Because remember, they're still in hospital gown, right? So, you know, that's not exactly the most modest outfit. So we typically can let them keep their blanket on. We might change it to a fresh, warm blanket, something like that. For the most part, we can let them do that. We're going to, again, communicate with their patient. Ask them to be able to move over. Needs to be somebody standing on this side, though. Okay? So we would identify the patient. We might ask them their name. Can you tell me your name and date of birth?
Alright, July 8th, 1971.
Well, good morning. We're here in the OR. We'd like to move over onto the table. If you just kind of feel beside you, you can kind of feel where the table is. See if you can just kind of scoot yourself over to the table. Can you do that for us, please?
Yes.
Now, you're anesthesia, right?
I did
Okay, if
drop
you're playing
it
anesthesia,
with my left
anesthesia,
leg.
what are you paying attention to?
For his,
All right, you're looking for your IVs because that's your access in an emergency. You got to have that, right? If there's some airway issue, you might want to be worried about that. Another thing that you're interested in is where is his head going to be when he lands over here? You see where that donut is? That's about where you want his head to be. So sometimes before you get this thing locked in, you'll be communicating. Let's move this up or down a little bit.
Okay.
See, like he's a little low, and we could try to move him after he gets over here, and that's not uncommon. But sometimes we can deal with that just by positioning the gurney higher or lower.
Okay.
And then lock the break.
Do we need it up?
Yeah, we need to move here because his head is too low. Are you okay, sir?
Now lock it.
All right, lock it before he.
Yep.
Jesus
All
Christ!
right, right there in the middle, right there.
Oh my God!
So you're managing his airway. Look where his cord is. He's laying on his IV now. So you haven't let
I'm
him.
gonna lift your head.
All right, now when you get him over here and you're fairly confident that he's where he needs to be, can you move over just a little bit more? There you go, good. And feel the sides of that bed, you can kind of center yourself on that. All right, and now you can move that away. What I always like to do is this person kind of needs to make sure the patient is secure. Okay, so that's out of the way. Now we can put the other arm board on, and that can go out into the hallway usually. We're done with that.
Other arm boards down there.
Arm boards down there, we put that on, and safety strap. Put a safety strap on this guy. So where's our safety strap?
That's a good question.
We ain't got one.
Oh.
No safety strap.
You already knew that, honey. Look, girl, right there.
Good.
Orange chair.
Ozzy, other end. Other end.
This end. There you go.
Ozzy.
Just
Oh, so high? Okay.
Really roasting.
There you go.
Yeah.
Wires or safety straps.
That's too.
Yeah. Okay.
Slide. Alright. Yeah,
Are you going to crucify me?
yes.
Yes, sir.
Put some restraints on the patient, please. He's getting disgruntled.
Are you going to crucify me?
well, I've got these chemical restraints, don't worry.
Put a little something extra in his bag.
Right here.
It needs to be 2 inches above me, so we're looking to put it there. That's where we want
My
it.
patient was right here.
Well, depends on what they're doing.
Just
The
safety
patient.
strap.
This is our kind of
That's where
generic
they did it.
location, 2 inches above the knee. If you're gonna put your patient in lithotomy, something like that, so if we change that, but this is sort of our generic starting point until we get the patient position. All right, this is not gonna be right, but we can approximate it with this. Okay? This is not correct, but we're gonna pretend that it works. All right, so the safety strap's on. So if we're doing an abdominal procedure, something like that, this is fine. As a matter of fact, you can even put that on there, and then if you needed to expose the patient, you can even leave the blanket on, cover it up like that. One thing about the safety strap should never go on skin, so always put something underneath that. Towel or blanket, something like that. Remember, we treat our patients like little infants. They don't ever touch anything unpleasant. We often cover arm boards. These will have sleeves on them, or towels, something there as well. So we do our procedure, and let's say we're done with our procedure. Okay, so procedure's over, and that's about what it's going to feel like for the patient because you've been unconscious. You went to sleep and you woke up. You don't really have any awareness of the passage of time. So let's say we're done with that, and now we're going to transport our patient out of surgery. Okay, so we bring the gurney back in. The arm board there has to come off, so we have to do something with the arm, right? This arm. What are we going to do with this arm? Now this patient is probably awake, but they're drowsy. Okay, they're still under the effects of anesthesia, but they're responsive. They can do some things, more than likely. So we can ask them, say, and you put their arms here. Can you just hold your arm right here? Maybe you kind of give yourself like a little hug. Sometimes we're not good about that. And if you're this person on this side, you're fighting with that. One of the things you're going to see is that when people come out of anesthesia, you don't really know what they're going to be doing with their arms. Sometimes they're pulling at their ET tube, they're clawing at their eyes, and you're having to hold their arms down. So don't be surprised when that happens. Okay. You cannot trust this patient to move themselves. Yeah, is it locked? So we are all going to move this patient. We're going to use one of those devices over there.
I should have did his strap first.
We can use either of those. I suggest the rollerboard. Let's use the rollerboard.
Rolling board.
Okay, we need a sheet to go with that. Draw a sheet.
You couldn't put it on your birthday?
Yeah, we probably could, but whatever.
This too.
That's what it's there for, but it just depends on the circumstance. If I do that, then I'll have to get different for the next group. And besides, I want you to see how to put a draw sheet around one of these. Are you out of sheets?
Yeah.
Do you look underneath the cabinet there that says sheets and blankets?
It's over there, it's on the.
Under the cabinet?
Oh, yeah.
Yeah.
Little flexi blackboard.
Now, we don't want this thing unfolded too much. Really, something like that is enough. You get it unfolded too much, it just gets in your way. Okay, ready to put this side down too? In the middle. Because you have to get up here. And if you're a small person, often you'll actually be on the bed for this. All right, so we've got the draw sheet around here. Okay, need somebody on that side? You're gonna need both hands.
Go ahead, you just video.
Okay.
Well, ideally, this actually is between the shoulder and the hip. That's where it normally goes. This, it'll make it a little bit easier if it's a little lower.
Unlock it.
Oh, sorry.
Only fingers. Okay. Okay. So again, you want to position this ideally so that it rides between the shoulders and the hip. That's where you want this thing. All right. So when everybody's ready, who calls the move? Anesthesia. Anesthesia is concerned about airway. Now,
Yeah.
you're going to have to, if you're anesthesia, you'll see them physically hold the head. You want to keep your airway straight.
How many people you need for transferring?
Minimum
right?
4, right? Possibly more, but at least 4 people. Anesthesia's at the top, they call the move. This person's job is going to be to first lift the patient some so you can get the rollerboard underneath it,
Just take the patient,
okay? And then to help move them this way, somebody has to control the legs.
right?
Okay, so
Don't help us, we'll.
we're going to do all the work. So you're going to hold on to the patient, somewhere around the shoulder and about at the hip here. Yeah, get it out of the way.
All right, ready?
We're going to roll you up, put this rollerboard, it's going to be a little
Is it right,
uncomfortable.
hold it here or here?
No,
You're gonna have to hold his
you're
head.
gonna have
So
to,
head is head.
like that,
Just lifting up
right?
one side of them.
Yeah, we're going to roll him up like that.
So who calls the,
Say one,
Be
two,
mindful of you're gonna have
Ready?
to
Ready?
one, two, three.
anesthesia is the
Okay.
captain of the ship, okay?
Okay, are you ready?
Yes?
Okay, 1, 2, 3.
Okay, so then I lift him,
And I'll put this
right?
underneath there.
And then,
Got it?
is he in?
Yeah, good enough.
All right. So
Okay, and
this
now,
sheet,
I'm gonna hold the sheet. It's called a draw sheet because I'm gonna use it to pull him.
right, so you guys can see, so you guys can come over here because you wanna see how this works.
While I'm pulling with the draw sheet, the rest of the team members are helping to move the patient towards me.
So all I'm gonna do is push, right? Again,
Okay.
go ahead.
Okay, 1, 2, 3.
Okay, and once the patient is over here, they're still halfway on that arm or that roller board. So now my job is to help lift the patient.
And all I have to
Hit his
do,
head.
right?
Hold his head.
That's to hold
Okay.
his head.
1, 2, 3.
Okay, and
Then
we'll
I
let him
just
down.
do this, right?
That's out of the way. Draw sheet now goes with the patient. It stays there.
And
Cover him up.
did you see how that roller worked?
Yes.
Okay, and just take your braces now, slide it out, and immediately put that armboard up. Watch your IV poles.
This is an arm board.
I did say armboard, but I meant to do it like that. All right,
And then his pillow. No,
give him
not
his
yet.
pillow. You can have his pillow.
Here, lift your head.
You can put his arms down, right?
You can put his arms to the sides if he wants, wherever he's comfortable with at that point. Actually,
Relax now.
generally arms to the sides are better because these people, because they're coming under the effects of anesthesia, they may not be breathing very deeply, and even the weight of your arm on your chest is enough to make a difference. Okay, and then we just roll him out like we rolled him in.
Do we participate in this, transport? Ah.
No.
Maybe. It's usually not us, but sometimes. Sometimes you could be involved in that. I've had to push a lot of poles.
Like, are there coughing?
Yeah, so depending on your patient, some of your patients recover in anesthesia. I do hearts, and heart patients don't recover in the OR. They recover up in CVICU. And so they're still intubated, the anesthesia's still running. And so they're having to transport the patient while continuously running anesthesia. So this person has a lot going on. They have a pole with a whole bunch of infusion pumps on it. You're having to bag oxygen the whole time. So the anesthesia's bagging oxygen. They don't have time to deal with that pole and all that other stuff. They've got monitors hanging off of them. You got EKGs. Big box usually sits right here. They got oxygen. There's so much going on. So you really need 3 people to do not one. Most of your patients won't need that though. Most of your patients, a couple people can handle it. Okay? Okay, we want to switch out. Different patient, different person. Repeat.